Your body is sending urgent warning signals right now that could reveal serious health issues, but most doctors dismiss them as nothing to worry about. These subtle symptoms aren't just minor inconveniences. They're your body's desperate attempts to communicate that something's wrong beneath the surface. The most alarming part? One of these signs is routinely dismissed as normal aging, but it's actually a red flag for a condition that affects millions of Americans without their knowledge. You see, your body whispers before it screams. The question is, are you listening? Every day, your body communicates with you through subtle signals. Changes so small they're easy to dismiss or normalize. By the time symptoms become obvious enough for immediate medical attention, underlying issues have often progressed far beyond their early, more treatable stages. Modern medicine excels at addressing acute problems, the proverbial screams of your body. But our healthcare system isn't designed to interpret the whispers, those early warning signs that something is beginning to malfunction. In the rush of brief medical appointments, subtle symptoms are often overlooked or inadequately investigated. What makes these hidden signals particularly dangerous is that they frequently indicate underlying imbalances affecting your entire system, not just isolated problems. Your body functions as an interconnected network, and these seemingly minor symptoms often reflect disruptions in that network long before major systems begin to fail. Consider Martha, a vibrant 62-year-old who prided herself on her active lifestyle and overall good health. Over several months, she noticed her feet were increasingly cold, even in warm weather. During her annual checkup, she mentioned this to her doctor almost as an afterthought. He quickly attributed it to normal aging and poor circulation common in older adults. Reassured but still uncomfortable, Martha purchased thicker socks and continued her daily activities. 6 months later, she was rushed to the emergency room with a dangerously low heart rate and severe fatigue. The diagnosis? Advanced hypothyroidism, a condition that had been silently progressing for months, with cold extremities as one of its earliest warning signs. If I had known this wasn't just about getting older, Martha later reflected, I could have avoided months of my health deteriorating. Martha's experience isn't unique. Every day, countless people ignore or normalize subtle body signals that could provide early warning of developing health issues. Today, we'll examine 5 of these hidden signs, symptoms that are frequently dismissed but often indicate underlying problems that deserve medical attention. Understanding these signals could be the difference between catching a condition in its early stages or facing a more serious health crisis down the road. Let's start with a seemingly innocent craving that might actually be your body sending an urgent message about your stress response system. That seemingly innocent desire for salty foods, the way you find yourself reaching for pretzels, salted nuts, or adding extra salt to your meals, might actually be your body's distress signal about your adrenal function. Your adrenal glands, small structures that sit atop your kidneys, regulate numerous critical functions, including your stress response and mineral balance. One of their key roles is producing aldosterone, a hormone that helps maintain proper sodium and potassium levels in your body. When adrenal function becomes compromised, often due to chronic stress, aldosterone production can falter, leading to sodium loss and triggering intense salt cravings. What makes this symptom particularly easy to miss is its seemingly benign nature. In a world where salt cravings are usually attributed to simple preference or habit, few people recognize them as potential indicators of what functional medicine practitioners call adrenal fatigue, or what conventional medicine might term adrenal insufficiency in more severe cases. The medical community often overlooks this connection for several reasons. Standard blood tests typically only identify extreme hormonal imbalances, missing the subtler dysfunction that can cause these cravings. Additionally, adrenal issues exist on a spectrum, with milder forms often going unrecognized in conventional medical settings focused on disease rather than dysfunction. Beyond salt cravings, associated symptoms might include unexplained fatigue, particularly in the morning and mid-afternoon, difficulty recovering from stress, lightheadedness when standing quickly, and increased energy in the evening when you should be winding down. These symptoms collectively paint a picture of a stress response system that's struggling to maintain balance. What makes adrenal dysfunction particularly concerning is its far-reaching effects. Your adrenal glands influence everything from immune function and inflammation levels to blood sugar regulation and sleep quality. When they're not functioning optimally, numerous body systems can be affected, often in ways that aren't immediately obvious. If you're experiencing persistent salt cravings alongside fatigue and stress intolerance, consider consulting with a healthcare provider knowledgeable about adrenal function, typically an integrative or functional medicine practitioner. They may recommend comprehensive hormone testing that goes beyond standard blood panels, examining cortisol patterns throughout the day, and measuring additional adrenal hormones. Supporting adrenal function often involves addressing the underlying causes of stress while providing nutritional support. This might include adopting stress management practices, optimizing sleep, moderating caffeine intake, and ensuring adequate intake of nutrients vital for adrenal health, such as vitamin C, B vitamins, and magnesium. Remember that salt craving isn't just about taste preferences. It could be your body's way of alerting you to a stress response system that's struggling to maintain balance. Cold feet, particularly when they remain cold despite warm environments or extra layers, represent one of the most commonly dismissed symptoms in medical settings. This persistent coldness in your extremities often gets attributed to poor circulation, aging, or simply being cold-natured. However, this seemingly minor discomfort can actually signal two potentially serious underlying conditions: thyroid dysfunction or impaired peripheral circulation. Thyroid involvement is particularly concerning and frequently overlooked. Your thyroid gland acts as your body's metabolic thermostat, regulating how quickly your cells convert nutrients to energy. When thyroid function decreases, a condition called hypothyroidism, one of the earliest signs is reduced heat production in your extremities. Your hands and particularly your feet become cold as your metabolic rate drops. What makes this symptom dangerous is how easily it's dismissed, especially in women and older adults. Conventional medical testing often fails to identify early or mild thyroid dysfunction, as standard tests have wide normal ranges that miss many cases of suboptimal function. A doctor may order a basic TSH, thyroid stimulating hormone test, see results within the broad reference range, and dismiss the symptom entirely, while missing the underlying thyroid imbalance. The thyroid connection becomes even more concerning when you consider that approximately 60% of people with thyroid dysfunction remain undiagnosed, according to research from the American Thyroid Association. Many suffer for years with symptoms like cold extremities before receiving proper diagnosis and treatment. Alternatively, consistently cold feet might indicate peripheral circulation issues, problems with blood flow to your extremities. This can stem from various causes including atherosclerosis, narrowing of the arteries, Raynaud's syndrome, or peripheral artery disease. These conditions restrict blood flow to your feet, reducing warmth and potentially limiting oxygen and nutrient delivery to tissues. What makes circulation-related cold feet particularly concerning is that they often signal systemic vascular issues that may be affecting other crucial areas of your body, including your heart and brain. Impaired circulation rarely affects only the feet. It typically indicates a broader issue with your vascular health that deserves medical attention. If you're experiencing persistently cold feet, consider requesting comprehensive thyroid testing beyond just the basic TSH test. Ask about including free T3, free T4, reverse T3, and thyroid antibodies for a more complete picture. For circulation concerns, vascular studies can assess blood flow to your extremities and identify any restrictions requiring attention. Don't allow this symptom to be dismissed as insignificant or age-related. Cold extremities often represent an early warning sign of conditions that, when addressed promptly, respond well to treatment and prevent more serious complications. Finding mysterious bruises on your body, ones you don't remember getting from any injury, might seem like a minor curiosity. However, this seemingly innocuous sign could be revealing important information about your nutritional status, clotting ability, or vascular integrity. Unexplained bruising occurs when blood vessels rupture beneath the skin without obvious trauma. While occasional mysterious bruises happen to everyone, frequent unexplained bruising warrants attention. The most immediately concerning connection is with vitamin K deficiency, a nutritional gap frequently missed in conventional medical assessments. Vitamin K plays a crucial role in your body's clotting process. When levels are insufficient, even minor bumps that wouldn't normally cause bruising can result in visible discoloration. What makes this deficiency particularly easy to miss is that standard blood tests rarely include vitamin K assessment. Unless specifically requested, which rarely happens, this important nutrient status remains uninvestigated. Beyond vitamin K, unexplained bruising may signal deficiencies in vitamin C or bioflavonoids, nutrients that strengthen blood vessel walls. When these structures become fragile due to nutritional gaps, they rupture more easily, creating bruises without significant impact. What makes this symptom particularly concerning is its potential connection to more serious clotting disorders or medication effects. Many commonly prescribed medications, including aspirin, NSAIDs, corticosteroids, and certain antibiotics, can increase bruising susceptibility by affecting platelet function or blood vessel integrity. This medication connection is frequently overlooked during brief medical consultations. Even more concerning is when random bruising indicates an underlying clotting disorder that might affect not just cosmetic skin appearance, but internal bleeding risk as well. Conditions like von Willebrand disease, hemophilia, or other clotting factor deficiencies often present with unexplained bruising as an early warning sign. If you're experiencing frequent unexplained bruising, consider requesting specific nutritional assessments focused on vitamin K status, vitamin C levels, and comprehensive clotting panels. A medication review with your healthcare provider can identify any prescriptions that might be contributing to the issue. Rather than dismissing these mysterious marks as simply bruising easily with age, recognize them as potential indicators of nutritional gaps or clotting irregularities that, when addressed, can improve not just your skin's appearance, but potentially your overall vascular health. A voice that sounds raspier, deeper, or more strained than usual, particularly when it persists beyond a typical cold or respiratory infection, represents one of the most commonly misattributed symptoms in medicine. This change in voice quality is frequently dismissed as the yangs, seasonal allergies, or vocal strain. However, persistent hoarseness often signals one of two significant underlying issues: thyroid abnormalities or chronic acid reflux. The thyroid connection is particularly concerning. Your thyroid gland sits at the base of your throat, near your vocal cords. When it develops structural changes like nodules or enlargement, goiter, it can physically interfere with proper vocal cord function, creating hoarseness or voice changes. What makes this symptom dangerous is that it might be the earliest detectable sign of thyroid nodules or growths, some of which may require medical intervention. Conventional medical appointments often miss this connection, especially if the hoarseness is subtle or intermittent. Without a thorough neck examination or appropriate imaging, the underlying thyroid issue continues undetected while the voice symptom gets attributed to less serious causes. Perhaps even more commonly overlooked is the connection between voice changes and silent reflux, technically called laryngopharyngeal reflux, LPR. Unlike traditional gastroesophageal reflux disease, GERD, which causes obvious heartburn, LPR often presents with few symptoms beyond voice changes. Stomach acid travels up the esophagus and irritates the larynx and vocal cords, creating inflammation and hoarseness without the classic burning sensation. What makes this form of reflux particularly insidious is its ability to cause damage without obvious symptoms. Many people with LPR never experience heartburn, yet suffer progressive damage to their vocal structures. Over time, this chronic irritation can lead to complications, including vocal cord lesions, chronic throat clearing, persistent cough, and even increased risk of throat cancer in severe cases. The medical oversight occurs because many practitioners don't connect voice changes to digestive function, especially in the absence of classic reflux symptoms. The patient might receive symptomatic treatments like throat lozenges or be told to rest their voice, while the underlying acid exposure continues unaddressed. If you're experiencing persistent or recurrent voice hoarseness, consider requesting a thorough thyroid examination, including neck palpation, and possibly ultrasound imaging to assess for structural abnormalities. For reflux concerns, specialized testing like pH monitoring might reveal acid exposure patterns that wouldn't be detected in standard examinations. Remember that your voice serves as an acoustic window into your health. Changes in its quality often reflect physiological changes that deserve proper investigation rather than simple dismissal as an isolated symptom. Those annoying involuntary spasms of your eyelid, medically termed myokymia, might seem like mere nuisances, but they often represent your nervous system signaling profound imbalances in your body's mineral status or stress response mechanisms. Eyelid twitching most commonly connects to magnesium deficiency, a mineral imbalance that affects an estimated 75% of Americans, yet rarely gets identified in standard medical testing. Magnesium plays a crucial role in proper neuromuscular function, helping regulate the electrical impulses between your nerves and muscles. When levels decline, these electrical signals become irregular, often manifesting first in small, highly innervated muscles like those controlling your eyelids. What makes this connection particularly easy to miss is that standard blood tests fail to accurately assess magnesium status. Since less than 1% of your body's magnesium circulates in your bloodstream, serum tests often appear normal, even in cases of significant deficiency. Without specialized testing that few doctors order, this critical mineral imbalance goes undetected. Beyond magnesium, eyelid twitching often signals chronic activation of your stress response system. Your nervous system relies on a delicate balance between excitatory and inhibitory neurotransmitters. When stress becomes chronic, this balance shifts toward excitation, creating heightened nervous system sensitivity that manifests in symptoms like muscle twitching. The connection is frequently overlooked because few medical appointments include comprehensive assessment of stress physiology and its impact on neurological function. Instead, the symptom gets dismissed as insignificant or attributed to fatigue or caffeine consumption. What makes this symptom particularly valuable as a health indicator is its early appearance in the progression from stress to more serious nervous system imbalances. Eyelid twitching often precedes more disruptive manifestations like tension headaches, sleep disturbances, or anxiety disorders. It serves as an early warning that your nervous system is struggling to maintain proper regulation. If you're experiencing persistent or recurrent eyelid twitching, consider requesting specialized magnesium testing, such as RBC red blood cell magnesium levels, rather than standard serum tests. Additionally, a comprehensive stress assessment that examines not just psychological factors but physiological markers of stress response can reveal underlying imbalances. Addressing the root causes often involves magnesium supplementation, particularly highly absorbable forms like magnesium glycinate, stress management practices, adequate sleep, and sometimes support for adrenal function. Many people find that these approaches not only resolve the annoying twitching, but also improve other aspects of neurological function, including sleep quality, mental clarity, and emotional regulation. Rather than dismissing these spasms as meaningless annoyances, recognize them as your body's subtle alert system, an early indicator that your nervous system needs support before more serious manifestations develop. These 5 signals, intense salt cravings, persistently cold feet, unexplained bruising, voice hoarseness, and eyelid twitching, represent your body's earnest attempts to communicate imbalances before they progress to more serious conditions. What makes them particularly valuable is their early appearance in the disease process, offering a window for intervention when issues are most responsive to treatment. The tragedy in modern healthcare isn't just that these symptoms get dismissed, it's the missed opportunity they represent. Each of these signals connects to underlying systems that affect your entire health: adrenal function, thyroid health, nutritional status, digestive function, and nervous system regulation. By addressing these core systems when they first begin showing signs of distress, you can potentially prevent countless downstream health issues. This understanding shifts these seemingly minor symptoms from annoyances to be endured into valuable information to be leveraged. They become not problems themselves, but rather allies in your health journey. Early warning systems designed to protect you from more serious issues. What's most empowering about recognizing these signals is that many of the underlying imbalances respond remarkably well to appropriate interventions. Nutritional deficiencies can be corrected, stress response systems can be rebalanced, and thyroid function can often be supported or restored when caught early. The next time you experience one of these symptoms, resist the urge to normalize or dismiss it. Instead, approach it with curiosity and respect for your body's communication system. Ask what this signal might be telling you about your underlying health, and seek healthcare providers who share this perspective, practitioners who listen to whispers rather than waiting for screams. Your body is speaking to you every day through countless signals. The question isn't whether it's communicating, but whether you're receiving the message. If you've experienced any of these hidden signals, share in the comments which one resonated with your experience and what you discovered was causing it. Your insight might help someone else connect the dots in her own health journey. And for more videos on understanding your body's subtle warning signs, subscribe to our channel and hit the notification bell.